Hello everybody, San here, engineer, MBA, and investor. And in today's video, I want to talk about the FDA putting on brakes on Vertex. This is breaking news. This was released earlier today. And of course, shout out to CRISPR Tommy for releasing that on YouTube, which I clearly missed that news. Obviously, I had a bit busy day today, but it is what it is. So I have time here to cover this news. And again, before we jump into this video, you guys know the drill. You guys know exactly what I'll ask you. Like this video, smash the like button, destroy that like button. If you're not subscribed yet, consider subscribing. Okay, so there's this article on Barron's, and it's on Bloomberg. It's on all sorts of news media out there, so it's quite verified at this point. In fact, Vertex actually released a PR just recently today. So the title is Vertex stock falls as FDA places clinical hold on diabetes treatment, right? So let's take a look at what this says. So the FDA has placed phase 1, phase 2 study of VX880 in type 1 diabetes on clinical hold, right? So just as a reminder, VX880, guys, it's a cell replacement therapy for people with type 1 diabetes. According to the FDA, the agency paused the study due to insufficient information to support dose escalation with the product, right? So the actual Vertex leadership here stated that we are surprised by the clinical hold placed on the study. These results from the first 2 patients treated with half of the target dose established POC by demonstrating that VX880 can restore glucose-regulated insulin production and improve glycemic control. You have an analyst here from RBC stating that it is somewhat cryptic given the favorable disclosed efficiency safety profile. Unless there's a major concern not being disclosed, it would not seem that this hurdle is insurmountable and it could potentially be addressed with additional follow-up. Right, so clearly some other analysts said something similar, saying that there is an opportunity here to buy the stock, considering it has failed over 8 to 9% since the news was released since yesterday. So my thoughts here, first of all, I'm going to say a couple of things here. I haven't really covered this program specifically. The only time I've actually mentioned about VX880 is when I was talking about CRISPR Therapeutics and ViaCyte's program with type 1 diabetes in Canada, specifically with Health Canada. So the reason why I'm talking about that is because the difference between that program and this program, obviously being a different technology being used, ViaCyte, what they're doing with their technology along with CRISPR, and obviously Vertex, what they're doing here, completely different set of technology. But the main difference is here Vertex is dealing with the FDA, right? And obviously all companies are going to have to deal with the FDA in the US, right? I'm not saying CRISPR Therapeutics and ViaCyte are exempt from that, right? But as it stands, ViaCyte and CRISPR Therapeutics program is with Health Canada, right? Which is the regulatory body in Canada. Vertex has to deal with the FDA when it comes to type 1 diabetes. And it looks like the FDA said, no, hold on, put this in a hold. We need more information to support dose escalation. Now, I actually agree with the analysts here. The data that I've reviewed when I was making that CRISPR Therapeutics video, actually I used CRISPR Tommy's video as well at the time. And even in today's video, Tommy stated very, very well, there's absolutely nothing wrong with the data that we have in front of us. Now, unless there is some sort of hidden information that we're completely missing out on, this looks extremely weird. It is cryptic, and I would definitely agree with the analysts here. I definitely agree with CRISPR Tommy, and I think all shareholders of Vertex would be definitely disappointed with this decision, including obviously Vertex leadership board, which clearly they mentioned here, stating a press release shortly after this pause that was announced in the media outlets. So I think this actually reiterates a couple of problems in the space, in my opinion. First of all, I think it's great to have regulatory bodies in the space of biotech, in the space of genomics. I think it's extremely important. You don't want these startups to be launched and then putting any type of medication in human bodies that are damages that are irreversible. I mean, and I know, when money is involved, ethics and morals take a backseat for many people. If not for all, arguably, we could make that argument. If it wasn't for regulations and for bodies like FDA, Health Canada, EMA in Europe, overseeing these companies. So there is a positive side of these types of actions, right? Obviously, there is a reason why the FDA put the pause on it. I think it would be extremely immature to say that they just did it out of spite, or they just did it, because maybe they weren't, they were getting some sort of data that wasn't necessarily vibing well with them, data being public, right? All data we have public so far for VX880 seems fair, seems fine, seems absolutely normal. Nothing's wrong with that, especially with this small end sample that we have. I think there's 2 or 3 end sample at this point, very small. But clearly there is some discussion behind the doors that we're completely omitting here. Obviously, the Byron, Bloomberg, and all other media outlets are not aware of this, including CRISPR. And that is, of course, explained by the misunderstanding of this news, right? Even myself, I don't understand what's going on. So there is definitely something here. I want to give the FDA the benefit of the doubt. But clearly here it shows an issue with our system. I mean, you have these companies trying to cure cancer, trying to cure diseases, and then you get this hold without any sort of reason. I'm quite confident the FDA, or at least one representative in that organization, obviously reached out to Vertex or vice versa, and probably have ongoing discussions. I'm going to take a guess that they're going to work overtime the upcoming days to resolve this type of hold. So I wouldn't be worried about the communication side, in my opinion, especially not in this day and age. I just think it's completely weird that in this day and age, we have this cryptic type of news where, you have this huge company, Vertex is a huge company, is being put on hold without any sort of explanation. They're saying that, insufficient information to support dose escalation, but that is unacceptable. You cannot do that, not in a business, right? As a regulatory body, yes, you have the power to put a hold on it, but it is your duty, and it is your duty to citizens and residents that you're covering health and safety for, to explain that reason, right? Because this is ultimately lives into play, right? Type 1 diabetes, I don't have to tell you guys how much insulin is being injected in these people. It's completely crazy that in 2022 we still don't have a viable treatment, alternative cure to type 1 or type 2 diabetes. I mean, having a workaround is not a cure, right? Living with a machine and regulating your sugar intake is not a way to live. Okay, it's not a way to live. I've had close ones in my family that actually had type 1 and type 2 diabetes, and I can tell you with experience that it is extremely unfair for those people. And if you're watching this channel and you have one of these 2 diseases, you know exactly what I'm talking about. So very unfair. I'm siding with Vertex here. I'm siding with the analysts. I'm siding with CRISPR. I really hope the FDA sets out their press release there and explain it furthermore, or Vertex or one of the people actually explain what the hell is going on here. Lots of questions, lots of unknowns. This is the downside, I feel like, when you have too much bureaucracy and too much red tape. I think the intentions are good. I really do think the intentions are good. But unfortunately, the actions here taken are not aligned with the best of the population, in my opinion, and obviously the opinion of many other people in this space. Again, we'll end this video like this. Thank you so much for watching. If you found this value, like this video. If you haven't subscribed yet, consider subscribing, and I'll see you guys during the week. We'll have a busy week. Thank you so much for watching, and have a beautiful week. Thank you.